Hi, my name is Dr. Julie Mitchell. I'm a prosthodontist here at Nevins Dental Center. So a prosthodontist is involved in all phases of reconstructive and restorative dentistry. I pride myself on taking part in the planning phase. When a patient starts with a very complex dental problem or presents with a very complex dental problem, we talk through options, whether it's missing teeth congenitally, if that's the way you were born, or missing teeth due to periodontal disease, bone loss, or dental decay, or even surgical issues. I am involved in the planning of the reconstruction because we always like to begin any sort of dental reconstruction with the end in mind. We want the patient to be able to chew, function properly. We want them to like the way their teeth look. We want them to be able to speak properly and also be able to maintain their new crowns or implants for the rest of their lives. And so my role from the very beginning is to get involved in the treatment planning, because if we understand why a patient has lost teeth or is missing teeth or requires some sort of complex dental care, we can better provide that for them long term. So you fix the root of the problem and then do it in a way that's functional, aesthetic, and will last a long time. Beginning with the patient when they start with the planning and then moving them through treatment is the most important part of what I do. The second thing that gets me out of bed in the morning is the artistry and the design. I see myself as both an engineer and an artist, and so providing patient with a dental reconstruction that will hold up long term, right, with the proper number of implants, distribution of implants, correct materials as far as any sort of ceramics or components that we need, that sort of engineering design of a dental reconstruction combined with the artistry. We want it to look like the patient is supposed to look, like they have an ideal dental situation. And so it's not so much about, the cosmetics of it, but about making the smile that you feel you're supposed to have. And working with the patient from the very beginning, the diagnosis, to the sort of engineering phase where we're deciding on surgical treatment options or restorative treatment options, to that final aesthetic touch that really makes you feel like these teeth are yours and they're what you're supposed to have. We have to really make sure that we're doing the work with the greatest attention to detail possible. So my appointments usually aren't fast. Usually there is an element of the personal care, attention to detail, this ability to really dig in, even if it is just a couple teeth. Why you have this dental problem, how do we fix it for you long term, and help you really restore your dental health. I really believe in the team approach toward treating complex dental problems. Having Dr. Nevins with me, as well as other specialists in orthodontics, endodontics, and oral surgery, really allows me to bring to the patient a very integrated approach toward dental reconstruction. It allows me to sort of think of everything and use all of the tools and the sort of toolkit that dentistry has to offer to provide the most ideal restorations for patients. I really like to say to a patient, I see your problem. I acknowledge your problem. Let's try to figure out how you got here so that it doesn't happen in the future. Let's design a treatment plan that fits your life. Let's get to know you, what you value, what you need, and work with you to really come up with something that will give you your dental health back. And whether it's one tooth or 5 teeth or an entire mouth reconstruction, working with the patient to really get to know them and diagnose their problem properly instead of just focusing on offering some treatment or treatment plan is the most important part. And I think that's what Dr. Nevins does exceptionally well.